Welcome, everyone. Today, we are focusing on how to respond when students disclose trauma or mental health concerns. A lot of faculty and staff worry about saying the wrong thing or overstepping. And our goal today is not to turn you into counselors within the span of our time together, but it's to help you feel more confident, compassionate, and clear about your role.
Name is Joshua Parrott,
And
uh,
I am Sophia Ritchie. Hello.
and we are wellness advisors at the Engineering Wellness Center here at the University of Kentucky. So, part of our job as practicum graduate students is in this resource, we offer wellness services to engineering students, supporting mental and emotional and physical well being. We believe that wellness is essential for success in both academic and professional life. And in addition to these services, we also offer outreach programming, including presentations to engineering classes on prioritizing mental health and presentations like this, kind of helping faculty think about best practices towards communicating with students when they do come up with a mental health concern.
And a lot of engineering students often view faculty as mentors. So, because of that, you may be the very first person that they tell something to. And engineering culture often emphasizes independence, pushing through that difficulty. And when disclosures happen, it's your job to have a compassionate response and an appropriate referral, not treatment. So, today we're going to cover kind of what to say in the moment, when reporting is required, how to move towards resources, and when safety overrides consent.
So, at the Engineering Wellness Center, we have also conducted some research and collected some qualitative data over the many years with engineering students here at UK. And we've collected some pretty salient themes that we think are relevant when discussing mental health concerns with faculty. Students can consistently describe a meaningful difference between procedural support and relational support. So, by that, I mean procedural, maybe it's required in the syllabus as a statement with where the counseling center is or listing campus resources. Those are often interpreted by students as institutional requirement, right? But not necessarily an invitation to engage or something that the faculty are bought in on themselves. In contrast, relationally attuned support involved tone and genuine openness. The students really got the impression that the faculty believed in what they were talking about and believe in mental health wellness. Students reported that they can tell the difference between, I have to say this, and you can actually talk to me. And in moments of crisis, that distinction can be pretty significant. The second one we have here is competing with engineering norms. Of course, in the broader engineering literature, we know that self-reliance and independence and grit are all massive themes that engineering students believe they are expected to embody. And we see how that, in addition to students perceiving weed out classes and other ways of kind of pushing the weakness out of a program, they see that as impacting help seeking as well. So, in this context, when students disclose distress to a faculty, it may feel like they're admitting their incompetence, or maybe even admitting that they feel they don't belong as an engineering student. For students already worried about being perceived as incapable, this can amplify fear and discourage help seeking. So, even small signals of flexibility, communicating to a student that their well being matters far more than a single grade or deadline, can be really powerful in reducing this perceived risk that they have. And of course, the last one we want to name are power dynamics. Of course, when students are going and confiding in a faculty, they're confiding in someone that does have some evaluative control over them. Faculty were described as a double-edged sword in this qualitative data, with students reporting carefully calculating whether that disclosure might change how they're seen, affect future recommendations, or influence academic outcomes. And as a result, they really went into those conversations high stakes. What this can mean for faculty is really thinking about those small signals of empathy. So, thanking the student for sharing, affirming that their well-being matters, or explicitly reassuring them that support will not harm their academic standing can all significantly shift a student's willingness to engage with that help and talk with faculty. Additionally, we also want to talk about what a trauma disclosure might look like. So, what kind of counts as a trauma disclosure? It's not always explicit statements like I was assaulted or I'm suicidal, which, of course, those would be included. But often they can be indirect. They can be gradual or they can be embedded in academic concerns. So, hearing comments like, I can't focus anymore. I don't see the point. I'm just exhausted all the time. I don't think I belong here, or I'm dealing with stuff at home, can all be statements that might cover a deeper concern. Maybe not trauma in and of themselves, but it might warrant asking additional questions because these statements signal overwhelm, depression, maybe even burnout. They deserve attention even if they do not require immediate emergency action. So there may be times when you initiate the conversation because maybe you've observed changes in the student. Maybe how they've acted at the beginning of the semester isn't how they're presenting now. Other times, a student may approach you directly. In either case, your role is not to diagnose or investigate, it's to respond with empathy, assess for immediate safety when needed, and help connect them to appropriate support. Most disclosures are not going to be emergencies, but all disclosures do deserve a thoughtful response.
Yeah, so a student has come to you and they've said a disclosure, they've told you something. Part one of this is just hearing them out, but what do you do in that moment? It can be a little startling, a little jarring. And so what we encourage is to regulate yourself first. Don't feel like you immediately have to say something. Take some deep breaths, take a pause, count to 30. And then say things like, I'm really glad you told me, to kind of acknowledge that trust. Okay, some students come and they might feel guilty later. They might say, oh, maybe I shouldn't have told them. So by acknowledging that trust, saying something as simple as, thank you for telling me, or I'm glad that you told me this. Thanks for sharing this, can really, really, really lead you to validate that experience as well and say, that sounds incredibly difficult. Validation is recognizing that emotional reality for that student. And so when a disclosure happens, following those steps can be very, very helpful in that moment.
So, what might be some additional steps to think about when we're trying to practice that active listening with students? The first thing we would want to emphasize is reflecting their feelings and name the emotion you're hearing. So, saying, that sounds overwhelming. You sound really discouraged, or you sound exhausted. Even if you're slightly off, the student will likely clarify, but it shows that you're engaged in the conversation and you care to understand what they're feeling. Second, restate the thought and briefly summarize what they've shared. So something like, yeah, hearing about the workload and what's happening at home, they're both really affecting your focus. Or, yeah, you're worried that asking for help and talking to me might make you look weak. This shows that you're tracking with them and that you're also preventing assumptions. Finally, normalize without minimizing. Healthy normalization can sound like, given what you've described, it makes sense that you'd feel this way. Or a lot of students struggle with this even if they don't feel comfortable talking about it. We don't want minimizing to sound like, everyone feels this way, engineering is just hard, or you'll just get through it, right? With that type of messaging, maybe decreasing help seeking. The difference is subtle, but students can often pick it up. So really validating that it is a tough situation, but also that they're not alone in it. And as a concluding thought, active listening does not mean becoming their counselor or, again, mental health professional. It just communicates, hey, I hear you. I understand how you're struggling. You are not alone. In a culture that often emphasizes self-reliance, that message can be pretty powerful. So before our conversation goes deeper, it is also important to be transparent about your role as a faculty member. So unlike counseling or healthcare settings that often operate under HIPAA confidentiality, conversations with faculty are usually not confidential in the same way. Most faculty are mandated reporters, for one. This means that if a student discloses discrimination, sexual harassment, or sexual misconduct, in addition to abuse of a vulnerable adults or credible harm of risk to themselves or others, for all of those situations, you're required to report that. And each one of those can look different depending on the reporting procedure. So it's really important to clarify your reporting obligation early, especially if the conversation appears to be moving towards that sensitive territory. Transparency protects both you and the student. So saying something like, hey, before we continue, I want you to know that if you share certain types of information, like sexual misconduct or harassment, I may be required to report that so that the university can respond appropriately. I want you to have that information before you decide what to share. Also, if you want to share that information in a confidential space, I can get you connected to a university resource that can do that. Or if you want to continue to talk to me, we can talk about what that reporting would look like together. Now, not every disclosure requires reporting, and we'll go into some of those details in a moment, because it's important to know that distinction. But when reporting is required, it's good to clear it up sooner rather than later to help build and preserve that trust. And it also supports informed choice of the student deciding what they want to share or not share. When a report must be made, it's also helpful to explain what happens next and again involve the student as much as possible. Clarity and collaboration can reduce fear and maintain the student's sense of personal agency, even in situations where the reporting is required.
So, if authentic and brief, you might even share that support helped you during a stressful time. This reduces stigma without centering yourself. So, the goal of brief, appropriate self disclosure is to kind of normalize that help seeking, to reduce the stigma, to model the balance, to avoid centering yourself and avoid shifting the emotional labor onto the student. So, when I say that, it should be short, 1 to 2 sentences, it should be relevant, not emotionally heavy, not unresolved, and not more intense than the student's disclosure. I think that one is very important to point out. So, I want to give an example. Perhaps you have a student that comes to you and says, I'm drowning. I feel like I should be able to handle all of this relating to school. So, potentially, a response for you could be, I remember during my PhD, there were points where I just thought I should push through everything on my own. And what actually helped was talking to someone outside of my department. Getting support, it didn't make me less capable. It actually helped me stay in the program. And that works really well because it challenges the I should do this alone narrative that a lot of engineers have. It models help seeking. It doesn't disclose any traumatic nature that you have gone through, and it keeps the focus on the student. Now, I want to take a moment to talk about what not to do, okay? Avoid making it personal, saying things like, oh, but let me tell you about my divorce. Okay, that might be a little bit too personal in this moment. Having long personal stories that feel like you're unloading emotionally on this student. Comparing severity. Maybe they're telling you about an experience and you say, oh, well, you should have seen me. I had it way worse, or something like that. Or making the student comfort you. Those are not the goals of this. If your disclosure takes more than 30 seconds, it's probably too long and not appropriate. So, for a quick rule of thumb, before sharing, just ask yourself, is this for the student's benefit or mine? Is it brief? Is it less intense than what they shared? And does it point them towards support? And if yes, that is an appropriate disclosure.
Now, at some point, the conversation does need to shift from active listening and self-disclosures to connecting the student with additional support. The key is to make that transition feel caring and collaborative rather than dismissive, like you're just passing the buck on to the next resource, right? So first, we want to express care. Before even mentioning resources, reinforce that you value what they already shared. So, I'm really glad that you told me about everything that's going on, and I really care about what you're going through. Second, emphasize that support exists beyond you. It's important to communicate that while you care, you're not the only source of help, and you may not even be the most useful or relevant source of help. So saying something like, hey, I want to make sure that you have support beyond this conversation. There are people on campus whose role is to help students through situations just like this. And then third, ask permission to discuss those resources. Would you be open to talking about an option that might help? Or can we look at a couple of supports together? Then you can offer one or two most relevant resources, ideally not a long list. The goal is to maintain connection while expanding their support network and not overwhelming them with a whole bunch of resources at once, right? Prioritize campus-based supports, ideally some that you or another faculty or trusted student could even accompany them to access the resources as a physical warm handoff. Now, there may be times when students are seeking support outside of business hours. Therefore, it's really important to know what university after-hour services are available to students. If the situation involves the immediate concern for the safety of the student and or others, of course, you can always call 911, the 988 suicide and crisis line, or other emergency resources that may be in the area. It can be helpful to familiarize yourself with those resources, in addition to talking with the broader university of what would be best practices in those emergency situations.
And it's important to keep in mind you cannot control the behavior of your students, but you can lower barriers and follow up. So, whenever connecting with a student and helping them get connected to resources, saying something like, "Hey, would you be open to me checking in next week, seeing how this is going, seeing how you're doing?" Offering to walk students to a referral site or helping them email or fill out a form or make a phone call can be very, very, very helpful. And lastly, just clarifying the purpose and the goal of getting connected to resources is important. Unfortunately, we don't have a magic wand that we can wave for students, but, identifying that support can potentially provide solutions. And that kind of relief, that next step is very important.
So we talked
So,
about in, oh, sorry.
apologize. Please go ahead, Joshua.
We talked about in some earlier slides, breaking apart when to report and when not to. And so it can be really helpful here to really differentiate when and how those procedures should look. So with the immediate risk of harm to oneself or harm to others, we would likely want to report to the local police department and other emergency resources, right? If we're worrying about the immediate safety. If it's more imminent risk of harm to self or others, so maybe a student has expressed that they have intent to die within the next week or two, it's still a very sensitive situation, but it's not necessarily an immediate emergency like calling the police department would be, right? So in this case, we would really recommend reporting to the university's mental health triage resource. That may or may not be the counseling center, but whoever is the first line of mental health defense for those students would be the ideal choice there. As far as lower concerns for general wellness, if it doesn't strike you as a severe mental health concern, there can be multiple university support systems. Maybe there is an advising system within engineering. For University of Kentucky, of course, at the Engineering Wellness Center, we would be an appropriate resource for this level of risk or of need of care. But there can be other resources on campus as well. Again, familiarize yourself with what your university offers. Specifically with child abuse and abuse neglect of an adult with a disability. This is going to relate to federal and state laws relating to that type of reporting. In Kentucky, we are, as faculty, required to report any child abuse suspected or abuse neglect of adult with disability, and that's something that is done directly. That is not done through an additional mental health support or counseling center. So again, refer to what your state's guidelines are. We'll talk about what Kentucky's are in a second as an example, but just be familiar of when you might need to do that required reporting. And then finally, for Title IX, this is regarded to the mandated reporting that faculty often have to do as it relates to discrimination, sexual violence, and sexual harassment. And we'll talk about those in a few moments as well, but often that looks like reporting to your university's Office of Equal Opportunity. And I want to name many different types of things that students can present here. So it makes sense to feel a little overwhelmed, but really being able to differentiate can be helpful when you think about next steps. And so here you can see an example of what mandated reporting might look like in Kentucky. And so you can see examples here with child abuse, neglect, and dependency, adult abuse, neglect, or exploitation, human trafficking, and domestic or dating violence and abuse. Now, it may be uncommon that you are hearing these types of concerns from students, but it is helpful to have a sense of what might be next best steps. So, as an example, seeing that with domestic or dating violence and abuse, the contents of the report is determined after discussion with the victim. And it's as far as when to report, it's upon the request of the victim, which looks very different from child abuse, where it's not upon the request of who shared, it is automatic. So just being able, again, to look at the different criteria across the different needs to report can be really helpful. And again, if all else fails, turn to the higher ups in your organization, turn to your university's Office of Equal Opportunity for guidance if you feel like you're not entirely sure which next step to take. And then the very last piece I'll share regarding Title IX compliance is again, all faculty are mandated reporters needing to report suspected sexual harassment, misconduct, and discrimination. So examples of that could be with sexual harassment, quid pro quo, doing a sexual favor or some type of unwelcome sexual conduct in order to get some type of aid or benefit. Also, a hostile environment where a person has a reasonable reason to think that their environment is so severe or pervasive or objectively offensive related to their gender. And then sexual assault, which can include dating violence in addition to stalking. I won't go through the exhaustive list because ideally your university has also given some Title IX training. But again, just being familiar with what it looks like. And as we said before, having that conversation with students of what you are required to report as a mandated reporter and leading them to confidential spaces if they would like to speak about those things without having to worry about it being reported. And so setting those expectations up front. Finally, some additional training to look at. This would go beyond the presentation that we've had today, but if you are interested in even having some additional training as it relates to these conversations, QPR, Question, Persuade, and Refer, is a brief evidence-based gatekeeper training that teaches you how to recognize warning signs of suicide, how to ask about suicide directly, and how to guide someone to appropriate support. It gives faculty a simple framework to interrupt a crisis and connect a student with help before the situation escalates. Additionally, you can also see the mental health first aid. This extends the training beyond suicide and crisis. It trains you to recognize, understand, and respond to signs of mental health challenges and crisis, including anxiety, depression, substance misuse, and others. Like physical first aid, the goal is not to diagnose with either of these trainings. Again, you are not expected to be a mental health clinician, but simply to provide that initial support and then get that student connected to professional care. Both trainings can strengthen your ability to respond with confidence, but neither are required. But they maybe can help with some of that uncertainty, especially in some high stakes conversations.
Yeah, and again, we really just want to emphasize you are not diagnosing, you are not treating. You are connecting, assessing, referring, and engaging, or as we like to use, the acronym CARE. So again, connecting with empathy, utilizing those active listening skills, assessing for safety, asking yourself in the moment, are they a harm to themselves or others? Do I need to report this immediately and get them to safety? Referring appropriately, knowing what your university has to offer, knowing what the community has to offer is very important. And engaging in follow up, again, as I mentioned earlier, saying, hey, is it okay if I just check in next week? Let's go ahead and get something on the books together. Could be a Zoom, could be in person, could be an email, whatever that is, whatever you feel is appropriate and what that student is comfortable with is what you should go with in the moment. So, you've learned a lot of great skills surrounding this framework today. And, we are so, so happy that you are here, you are listening to this, and you are willing to support students. So we want to ask, just to yourself as a final reflection, think about what is one sentence that you feel more confident saying to a student after today. So, thank you all so much for listening. We encourage you to connect with your community, connect with your universities, and continue to educate yourself so you feel more comfortable in a moment such as this. But thank you all so, so much.